Hello everyone, this is Ruby Pawankar, the President of the World Allergy Organization. Warm greetings to all of you from the World Allergy Organization. Today we are going to talk about pediatric asthma. And as you know, the prevalence of asthma is increasing worldwide, especially in children and young adults. This affects their quality of life and leads to increased costs. Moreover, underdiagnosis and inadequate treatment worsens the situation and leads to unwanted deaths. The World Allergy Organization is greatly concerned about this growing public health problem and is committed to increase public awareness as well as to the better dissemination of management strategies. As part of its various initiatives towards this, to address the issue of pediatric asthma and other such disease areas within the field of allergy is its collaborative efforts with the European Academy, the American Academy, and the American College for the development of international consensus documents. We have most recently published the second of the series of international consensus documents, the ICONs, and the second icon is on pediatric asthma. In this context, I would like to introduce to you Dr. Sylvia, a member of the World Allergy Organization's Pediatric Asthma Committee, who would be interviewing the chairs of the Pediatric Asthma Committee, Professor Ulrich Wahn and Professor Peter LeSoeuf. Thank you and enjoy the interview.
Hello, I'm Dr. Sylvia Sánchez-García, member of the WAO Special Committee on Pediatric Asthma. I am here with Professor Ulrich Wahn and Professor Peter LeSoeuf in Geneva, Switzerland, during the EAACI Congress. So, as co-chairs of the WAO Special Committee on Pediatric Asthma and experts in the field of pediatric asthma, what do you think about the prevalence of childhood asthma in the current global scenario?
Well, I think asthma, particularly asthma in childhood, like many other allergic diseases, have really become one of the epidemics of the 21st century. There was a long period of research and controversy of it, but we know now that not only in Central Europe, not only in America, but obviously as a global phenomenon, asthma prevalence is tremendous and really has to be considered as a major health issue, particularly in children and adolescents.
Thank you. And what is research doing to reduce pediatric asthma prevalence?
Well, that's a fascinating question, and for many years we've looked at allergen avoidance and using drug measures to try and reduce asthma. That hasn't been as successful as we wanted, but we're well aware that in some countries in the world there's very little asthma and others there isn't. And in those scenarios, we're starting to use molecular techniques to try and understand the gene networks. If you can understand which genes are involved, then you can understand how to intervene and maybe in that respect get cures. That's been done in cystic fibrosis recently, and it's a very important and potentially productive area of research which is people are showing a lot of interest now, and who knows, within 4 or 5 years we could have techniques which actually reduce asthma prevalence globally. We hope so.
Okay, well that's everything. Thank you very much for your...
This fits.